Our next presenter is Eric Tenkorang from the Department of Sociology at Memorial University of Newfoundland. Eric is a sociologist and a distinguished Africanist scholar whose work on HIV, AIDS, and gender-based violence is trailblazing. His research has highlighted the vulnerabilities of marginalized populations to HIV risks and violence in sub-Saharan Africa, offering innovative solutions to both academics and policymakers to initiate change. As a leading expert in his field, Dr. Tenkorang's scholarship has impacted local and global communities.
Hello, I'm Eric Tenkorang, Associate Professor of Sociology at Memorial University of Newfoundland. First, I would like to thank the Royal Society of Canada for providing the opportunity for me to share my work on this important platform. The title of my presentation is Sexual Health and Gendered Violence in Marginalized Populations. I have chosen this topic mainly because it encapsulates my research vision and ambition of improving the health and well-being of marginalized populations in limited resource countries. In this regard, my research has focused on two different but interrelated areas of sociology, demography, and public health. The first examines the sexual and reproductive health outcomes of young people and women in the context of the HIV and AIDS pandemic in sub-Saharan Africa. And the second explores the intimate partner violence experiences of women in African context. In this presentation, I'll highlight my contributions to these two important areas of focus. First, my research on HIV prevention was inspired by a visit to one of the major hospitals in Ghana, West Africa, where I met several HIV-positive persons as part of my undergraduate education, having witnessed the consequences of HIV and AIDS at first hand. And coming from a continent ravaged by the pandemic, I've always believed I had a professional duty and a moral call to contribute to an AIDS-free generation through research and advocacy. To date, my research has contributed to this field by critiquing existing HIV interventions as individualistic and atomistic, while providing evidence to demonstrate that structural approaches are effective, especially in sub-Saharan Africa, where socioeconomic inequalities and existing sociocultural norms are significant barriers to HIV prevention. Also, my work has helped improve school-based interventions in some African countries, including South Africa, Nigeria, and Kenya. In the cases of Nigeria and Kenya, for instance, my work demonstrated significant reductions in HIV vulnerabilities among young people, mainly as a result of some specific school and community-based interventions rolled out in these countries. These interventions provided young people with knowledge about HIV and AIDS, improved their skills, and enhanced their self-efficacy to engage in risk-reducing behaviors. In the other strand of research, I have been interested in the intimate partner violence experiences of women in Africa. I came to this research, first of all, wanting to understand or explore the links between intimate partner violence and HIV transmission, but later on realized that there was a gap and a lack of understanding of the experiences and vulnerabilities of female survivors of intimate partner violence in African contexts. In this regard, my research has helped or has contributed by helping us understand that violence against women in African cultures is unique and is more complex than often portrayed. Also, the work I've done in this area has helped broaden the scope of intimate partner violence research from its conventional focus on westernization and modernization processes to include how traditional practices and indigenous local structures actually increase women's risks of experiencing violence. Parts of this work has highlighted how marriage is often used to legitimize and normalize rape, calling on policymakers to criminalize this act. For instance, in Ghana, where the majority of my work on violence is focused, I have challenged policymakers to re-examine and revisit the Domestic Violence Act, mainly because of the silence on marital rape. Also, on a continent where child marriage is highly prevalent, my work has demonstrated that child brides face the worst forms of intimate partner abuse compared to women who marry as adults. In Africa, marriage is built around the concept of lineage. Thus, the lineage becomes an important sociocultural institution around which African societies are organized. The lineage is an important source of wealth, privileges, rights, and responsibilities. While there are several types of lineages, two are predominant, the matrilineal and patrilineal. For the matrilineal, inheritance goes through a maternal ancestor, while for the patrilineal, inheritance goes through a paternal ancestor. What is striking about these lineage formations and structures is that the power dynamics, the social norms, and access to economic resources actually differ among these lineage structures. My work has demonstrated that these differences also reflect in the IPV, or intimate partner violence, vulnerabilities of women who identify with these two lineage structures. As a result, my work has called researchers to understand violence against women through the lenses of local social structures, and also admonishes or calls on policymakers to consider these cultural nuances in interventions aimed at eliminating violence against women in Africa. In the future, my work seeks to bridge previous research on HIV prevention and existing current work on intimate partner violence by exploring the domestic violence experiences of HIV positive women living with HIV and AIDS in Africa. Also, as COVID-19 unfolds, there has been the need, or there has been calls for us to understand how pandemics create vulnerabilities for violence against women, and I'm moving in this direction. Thank you.